So there we go. Okay, this is Ralph Bender with Enduring Wealth Advisors, and I'm sitting here online with Tarkus Mossburg, who is a consultant that I've used for a while now to help my clients get their health insurance needs under control. Tarkus has been doing helping his clients for about a decade now. After developing working a career in technology where he worked with Oracle and some other people. Tarkus, welcome aboard.
Thank you.
So, getting started, what advice would you give my clients? They've done a good job, but they're retiring prior to age 65, and they're not ready yet for Medicare. What would you recommend? What are the steps that they can take to provide their health care coverage? Let's say they retire at 59 or 60, whatever. We've done a great job getting their retirement plans in place. They got the funds to do it, but they're worried about health care. How do they deal with that gap before they go on Medicare?
And that's a great question, because most of the people are not concerned with that period until retire from a company and then find out, hey, what do I got to do with health insurance now? And then it becomes a huge cost in some cases. $800 a month might be a $9,000 a year budget that they hadn't planned on. So the primary thing is if they can stay on their company's health insurance plan, that would be best. Now, most companies will not allow them to stay on their plan beyond retirement date, and I just use retirement to make it easy. Other people might call it something else. But government-type programs and things like that certain private companies may allow someone to continue on their company's health benefit plan after they retire.
Would that be a COBRA plan?
No, this is just on their plan at their company. Now, this isn't going to be, it's not going to be that common, but it's good for someone to find that out just now. If they find out now, hey, my company can let me stay on my benefits way after I retire, then at least that part's taken care of. Like I said, fire department, police, teachers, things like that.
And some big employers do that. One of the companies that we do a lot of business with, we've helped a lot of Chevron employees, and they get to keep their retirement plan for life if they choose to.
Exactly. That's why it's going to be different by company. They just need to talk to their HR rep.
Great.
You mentioned that the second option you mentioned was if they leave their company plan and they're not allowed to continue their benefits, well, then they're offered to go on to COBRA. And you got to do that within 63 days, and they can go on to COBRA without underwriting. I know you gave that look for 63 days. It's when you leave a company, you have 63 days to continue on with COBRA. If you miss that window, you're going to be left without insurance.
Now, is that something that regardless of who you work for, that if they provide an insurance plan, that they're mandatory to provide a COBRA option?
The benefit with the benefit with COBRA is that there's no underwriting. You just continue on your work plan, but you continue on it through this federal program called COBRA, or maybe it's a state program, and you got to sign up, like I said, within 60 days. Now, we both may have clients in different states, so they would need to look at the laws in those states. It could be 3 months that you're allowed to be on COBRA. It could be up to 36 months. Here in California, you get 18 months, and then you can renew that for another 18 months. So you really only have a 36-month window. So that's about 3 years. So if you're retiring at 62, that'll get you to 65. But if you're retiring at 58, you got to plan beyond that.
So who picks up the tab for COBRA?
Oh, your client and my client do. It's going to be more expensive than if they went and got an individual plan on their own, because they're assuming if you're staying on COBRA that you have health problems and you can't get insured on your own. So COBRA is typically going to be more expensive. Not always, but typically.
Okay. So what are some of the other options? You mentioned there's about 4 options.
Yeah, a good one is if your spouse is still working but one of the partners retires, just be added onto your spouse's plan. And you don't have to wait for open enrollment for that to happen. As soon as you leave your company, that's called a qualifying event, and you can then just get onto your spouse's plan that month.
Oh, okay.
So that's a really good plan if you're not aware of that. And then the final plan, which is pretty much the most obvious, is you come talk to someone like me and you go look for an individual plan.
Got it.
The only downside with that is if you have someone who's 56, 57, 58 looking for an individual plan, in the past you had to worry about underwriting. Now, this is going to change after January 1, 2014. They're not going to be able to deny them for previous health conditions, which would be great for your clients.
Are they going to be able to rate them, though? Or are they going to find I mean, how's the insurance company, I don't want to get into how they're going to make money. They'll figure that out. But if they have to accept everyone, are they going to be rated like they do with life insurance now?
It will be more expensive. How much more? The real laws that are going into place with healthcare reform really take effect January 1st, 2014. So we don't know how much everything's up, but you can guarantee that it's going to be more expensive than it is today. And we're only talking 11 months away. So yes, it'll be more expensive than today.
Okay, great. So if you know in advance, which we usually do, that they don't have any of these options, what else do you think that they can do?
Well, they will always have the option as of next year to go get health insurance through the exchange. And I say that because we're in a really unique time where everything's changing. So how we've done things today and in the past is going to be obsolete in 11 months. So in the future, they can go get health insurance through the exchange, and it may be more expensive. I can only talk about some of these other options as they are today. One thing you can always be aware of, at least in California, is there are going to be many government, federal, and state programs to help someone out financially if they're not healthy enough to get an individual plan on their own. Right now we have something in California called Mr. MIB, M-I-B. It's a major risk. It's for people who have a history of health problems. They can't get individual insurance, so they'll contact that program. And I'll usually point that to someone if they're contacting me and we can't get them insurance a normal way. I looked into it, and the other options that someone has, this isn't something that a broker would typically help them out with, but your clients, if their health was really in a situation where they couldn't get insurance, and again, next year they will be able to get it, so next year's models might somewhat model what they're doing now. They have something called Medi-Cal. So if people have low enough income, they'll have subsidies. In the state of California, specific counties will sponsor, so you got to call the county aid. So it's somewhat of a nightmare. If someone falls into this category, they got to do a lot of calling. A broker can't really help them, and they need to find the different avenues. But they should at least realize that there's more than one avenue. We don't know if all those different avenues go away come next year or not. So Mr. MIB is at the state level, Medi-Cal is at the federal level and state, and then you got the county level. And we don't know how those programs are going to change come next year.
So now those programs are primarily for people with what I guess we call impaired risk, people that have serious medical problems. We've talked about what they can do if they've got some options through their employer or through their spouse's employer. We talked about an individual plan. You had some creative ideas on if they've got a hobby or maybe they're retiring. So that I've got a client who quit working for a major employer, and now he loves cars, and so he buys antique Corvettes and puts new engines and chassis on them and turns around and sells them for 3 times what he paid for them, which is kind of cool. But so this might be a situation for somebody like that. He's got a hobby. How does that work?
Yeah, I like going this route, and I tend to help people in this kind of instance. I have a lot of people that have retired early. They've been successful. Maybe they leave their employer and go into consulting, or maybe start up an online business, or want to become a writer, so they incorporate a business so that them and their husband are the owners of the company. I mention all this because in the past, if someone couldn't get insured one way to guarantee them insurance is to do a small group health plan for them. Now you have to have a minimum of 2 people. It could be 2 owners. It could be 1 owner and employee. But
husband and wife?
It could be a husband and wife. I have several small group clients. It's just a husband and wife. They've created a ministry, and it was a nonprofit organization, and so they qualified for a small group plan, which means guaranteed insurability. Now again, in the future, they're not going to be denied coverage, but what they're offered might be limited within the new exchanges, and they might be very, very pricey. So going and having a broker involved to compare what the exchange offers versus potentially doing a small group plan, there's going to be a lot of tax benefits for having an employer-sponsored plan in place, and those are going to grow every year, so it might become more and more beneficial for people to look at that if they have that real business.
So, okay, so let's say you know, they don't want to run a business. You got any other ideas?
Well, there's another idea, and I only share it because it could be used. And if someone doesn't fall into any of those plans, this is a solution to provide in the past. Again, things change. Sorry, I just went blank there. Things are going to change next year, but the other solution is prior to leaving their company, they may want to consider buying an individual insurance plan. Now, that means they might have double insurance, and that's not going to seem like a smart thing to do, but when you do the dollars and cents and actually compare them, it's just another option. As soon as you get an individual plan, they can't kick you off and deny you, whereas if you leave your employer, you'll most likely lose that insurance. But if you were
you're with an employer and you've already got the group plan, and so now you buy yourself an individual plan, isn't that going to be secondary to the group plan, or is it going to be the other way around? I mean, while you're still got both plans, how do you coordinate the benefits?
There's no coordination. There's no double pay. That wouldn't happen. It would just be an extra out-of-pocket expense. Like I said, it's not going to be a popular solution, but at least people should be aware that it's out there. If you're only paying $150 a month, just do the math. You know, right now, a Mr. MIP plan or an exchange plan, someone who's 58 with a history of health problems, it might be $800 to $1,000 a month. So we're talking about $12,000, $12,000 a year that they might not have included in their budget when they've been meeting with you, whereas a $150 plan while they're still healthy, it makes sense, but most likely not.
But if they're healthy and they just decide to retire because they want to go do whatever it is, something else in their late 50s, for example, it might be real prudent to consider setting up that secondary plan because the COBRA is not going to last until Medicare, and perhaps the wife or the spouse doesn't have a plan or whatever. So it may make some sense for them to seriously consider taking on a second plan while they're still covered under a group plan. Does that make it easier for them to get the plan simply because they're already on a group plan?
No, it doesn't. They still need to be healthy. The key there is to have that before health becomes a concern. Like I said, very rarely, if we look at all the options, very rarely does someone need to even look at and consider that as an option, especially going forward with healthcare reform. But it is out there, so it's just a matter of comparing apples to apples and which is cheaper.
So we've talked about people that want to retire prior to 65 and some of the strategies that they can employ to provide that health care benefit during that time period. What are some of the things that somebody who, once they get to Medicare and they turn 65, they've already signed up for Social Security, or they haven't, but they've signed up for the Medicare, assuming they're on Medicare, what are some of the biggest problems or issues that you see with people? What are the big mistakes that people make as it pertains to Medicare?
Well, I was going to go over some of the typical things your clients would need to know as they turn 65.
Okay.
One, and this would cover maybe some mistakes. If they have a plan at their company, when they leave the company, if they're over 65, they have a certain amount of time to get a Medicare plan. So you have about an 8-month window if you leave your employer's plan.
Okay.
There's other rules. If you're not on an employer's plan and you start with, you turn 65, there's a certain number of, a window. So you need to work with a broker to find out what these windows are, because there's a window of time to apply without getting surcharges and penalties. So the typical solution is you let your clients know about 64, 64 and a half, hey, at 64 years and 9 months, that's when you can start applying for Medicare Part A and B if you're not working and continuing on your employer's plan. You're going to sign up.
So if you're working and on an employer's plan, and when you turn 65, they waive the penalty for not signing up at 65. Is that what happens?
There is just no penalty. If you stay on your employer's plan, that's fine. Then whenever you get off the employer's plan, you have a certain window to sign up.
Okay, so you have about 8 months to sign up.
Which is the biggest window out there, yeah. So if you're staying on an employer's plan and you're 70, I had a client who was 70, he was a doctor, he even had an individual plan. It wasn't an employer-sponsored plan, it was just an individual plan. And he didn't even look at Medicare, and he was a doctor. But when we looked at Medicare rates...
That might say something, doesn't it?
Well, he was paying about $2,500 a month
wow.
for an individual plan at 70. And when we moved him to Medicare, he was pretty much got the top of the line plan for about $300 or $400. So yeah, it saved him about $24,000 a year right off the bat.
Well, and I take it he was probably cutting back on the hours that he was working, and the revenues probably as well. So it was probably prudent. So I was always under the impression that when you turned 65, you pretty much had to sign up for Medicare. If you didn't do it, and you waited till you were 70, or you waited a few years, even a year, that you could be penalized for it. Is that not the case?
Well, that's true unless you're having insurance on a group plan or an individual plan. But typically, if someone's retired and not working, they would, yes, they'd want to go sign up. When we say Medicare, it gets confusing. We're talking about Medicare Part A, which is free.
Okay.
And Medicare Part B in 2013 is $105 a month.
Okay.
Nationwide. So A and B is going to be about $105 a month. Then there's your options of going with a Medicare supplemental plan to fill in all the holes, or instead of doing Medicare supplement, which is more expensive, you can do something called Medicare Advantage, which just basically takes your A and B benefits and changes them into something else and limits the amount of doctors you can go to. So a lot of people can get a Medicare Advantage plan with no extra cost.
Oh.
So I don't want to be too complicated because it can get, but the options are right away, the penalties are A and B. That's what you need to sign up for, and you basically just want to be in touch with the broker to find out, hey, by when do I need to apply for A and B? And then once someone gets A and B and they do that through Social Security, then they talk with a broker like me if they wanted to go beyond that.
Okay, and beyond that, they're going to get the supplemental plans that fills in the donut hole on the drugs and on Part D and some of those other things.
Kind of. Supplements don't include Part D. So
okay.
So you'd get a supplemental plan, you'd get a separate dental plan, and you'd get a separate Part D plan for prescriptions.
Oh, okay.
So all three of those are going to be different. It's obviously different by state and different by city. But that's the supplemental route that fills in the holes.
So in round numbers, I'm going towards cost for that person. You mentioned Part A is free, Part B is $105, I think you said. What does it take to provide somebody, what's it cost somebody to get a full-blown, basically so they don't have to worry about when they go to the doctor?
An F plan, supplemental, is basically the high-end plan. It might be might be $250, let's say. And basically, it means you don't pay a dime when you go to the doctor. Now, if you're used to paying, $800 a month when you're 62 and 63, going from $800 down to $250 seems like a great deal. If you're used to having your employer pay for all of it, and then all of a sudden you have to have a $350 bill, then it's not going to sound good. So it just is perspective. But I'd say about.
But what about the quality of service? Do you give up? I mean, I'm on a Blue Cross plan personally, and we pay. I don't know what we pay, but I'm going to say it's probably $1,000 a month if I'm not mistaken. Maybe it's less than that when we have a high deductible. But I can go to any doctor I like. I don't have to worry about. I have a small copay when I go into the doctor. I've got chiropractic, which, I've got a whole bunch of options for medical care. I probably should use them a little bit more. But what kind of am I trading down to get one of these plans for Medicare?
No, actually, Medicare has the best benefits out there, especially when you get the supplemental plans to fill in all the deductibles. So basically, zero deductibles, zero coinsurance, zero copay, 000 across the board.
I can't wait till I'm 65.
Well, like I said, it would be $105 for Part B, maybe $250 for supplemental plan, $35 for dental, maybe $25 to $40 for prescription drugs. That's what you can look at in terms of budgeting.
Okay, good deal. Are there any other things that you can think of that we should let people know about?
Sometimes people have the perception that if they want to save money, they should go directly to the healthcare provider, especially people turning 65. They're getting flooded by every health insurance agency in the United States. Buy our plan, buy our plan, buy our plan. One, it's not cheaper to go directly to the health insurance carrier, and when you call the health insurance carrier, they're not going to tell you about anybody else's plans. They're only going to tell you about their plans.
Got it.
I say this to encourage using a broker. It's not going to change the price of your plan. The commissions that are built into all these health insurance products are the same for everybody. It's not like somebody can offer a health insurance plan cheaper than the guy next door. So it's basically a commodity. So use your broker because he can find all the rates and he can give you the best deal. And especially with Medicare plans, Medicare supplemental plans in particular, there's only like 8 or 9 of these plans available nationwide, and they all offer exactly the same benefits. So it's only a matter of price and the service that the company offers that differentiates them.
So there's a difference between some of the providers as far as the way they service your clients.
Yeah, when you call someone and want to talk to a live human being on the phone, the difference between waiting 2 minutes and waiting a half hour can be very frustrating.
Especially when you don't feel good.
Well, yeah, and so the broker in that state will know, hey, this is a company that this is a higher level of service. Typically, they're going to charge a little bit more, but sometimes it's worth it. If someone really wants the lowest price, we'll go with the lowest cost plan. But most of the people that I work with that come from you or other financial advisors, they're just looking for an advisor to tell them what's in their best interest, and they're not worried about the details too much.
So basically, you're going to cut through the red tape. You know the lay of the land, and just like I guided them through their financial milepost, you're going to guide them through this landfield of landmines of what these different plans are. And it doesn't matter to you necessarily whether they go with plan A, C, or F, because you're not compensated that way. You're compensated by each plan is individual, and it's just a matter of what works best for them.
Right. I just look across all the companies that are offering the plan, try to find out what's best for them in their budget, the kind of benefits that they're either used to or that they want. And you're right. For the most part, it doesn't matter to me which company we go with. So it's just a straight helping them navigate and find the best one that's for them.
Well, I think we've kind of wrapped up the set of questions we had. Tarkus, it's been a pleasure chatting with you. Any final comments you want to put on the message here?
Yeah, it's real easy. If you're working with a client that wants some help, all you or they have to do is email me their date of birth and their home zip code. From there, I can put together quotes, email it to them, schedule a phone appointment, and then go over the details if they want me to go over the details with them. If they don't, that's fine as well. But it's really just as simple as getting a date of birth and a zip code, and then we can start talking real numbers.
And what is your email address for the record?
My email address is Tarkus, my first name, Tarkus, at healthymissions.com. And that's healthymissions with an S.com.
I'll make sure that it's printed out so they can click a link, and we'll go from there. Tarkus, thank you so much.
All right. Ralph, have a wonderful day, and thanks for inviting me.